What's going on, y'all? Hope all is well. Another episode of Combos with your CFP Mario Payne in beautiful Jacksonville, Florida. And what's beautiful for us lazy Americans? Ozempic, the weight loss. And who makes that? Novo Nordisk. NVO. And NVO has been ripping and running this year, growing like crazy. Not as much as Eli Lilly. You may have missed out on that train. But they have the #1 weight loss drug and the #3 weight loss drug. That is the third one is supposed to be for diabetes, but we know ain't nobody using that for diabetes. So we're going to talk about what Citibank says about them, and also, is it a good time to invest? Have we missed the boat? But before we get started, as always, like, share, subscribe to our channel as we continue to go. But let's go over Novo and what the people got to say about it.
Well, it's time now for Call of the Day. Let's start with Citi, which is maintaining a buy rating on Novo Nordisk, the big.
Now, Citi has a buy rating. You know the good thing with analysts? They're never wrong. Because if they have a price target that's wrong, they're just going to change it. So we really don't know. I know Citi called that Zoom that will grow like crazy. Not so much. They also called DocuSign going up by 15% when it's down by 80%. So take it with a grain of salt with these analysts. Yes, they know what they're doing, but if they're wrong, we never know.
Pharma company behind the diabetes and weight loss drug Ozempic, the bank is remaining bullish on the stock. That's even after a clinical trial showed the drug delayed progression of chronic kidney disease in patients, cutting the risk of a major cardiac event and death.
Wow. So major cardiac arrest taking the drug Ozempic. You think that's going to stop people? Of course not.
Death by 24%. It cut the risk of major cardiac and death by 24%. Most analysts, however, were looking for 30%.
Right.
So the street was actually negative largely on this study. The stock is down. Citi coming out and defending them.
Yeah, it sounds like next steps, the company does plan to report.
Down by 3% intraday. Is that a buying opportunity?
I guess file
on Citi coming out and defending them.
Yeah, it sounds like next steps. The company does plan to reportedly, file for regulatory approval of a label expansion, Julie, for Ozempic. That would be here in the States and the EU this year. To your point, some analysts.
Who is saying sell NBO right now? Who, and why, right? They get it right, they're shouting for the moons. If they get it wrong, they take it as a hold, then a buy. Pull the rug.
I saw it did say perhaps expectations were for an even stronger outcome. Also, you just look at this stock, though, too. I mean, you priced in a lot. It's yes, it's down. It's about 20% this year, 70% over the last 12 months.
Yeah, I mean,
now that is a lot. But its competition, Eli Lilly, is up by 135% the past 12 months. Again, 70%, 12 months. Man, that's like 5x the market what it does over 5 years. You did it in 1 year. So again, that's great. But its main competition, Eli Lilly, 135%. So it has some room to grow.
The company says it is going to have more details on the study at an industry conference later this year. And so the Citi analysts are looking ahead to that. They also say, the Citi analysts, that this signals no.
Buying that thing at 60 now is at 124. You double your money. And think about that, right? So people think, to make 100%, you double with compounding interest, right? You actually only really need to make 75%. You make 75% with compounding interest, you actually double your money.
Novo's intention to be quite aggressive with expanded indications for this drug, so that there's more possibilities of more patients being prescribed it. Exactly, that there's a lot of different things. On the flip side, I should mention a little bit of a tertiary effect today, or secondary effect, for Fresenius, Baxter, DaVita, all of these companies that make things to help. They make dialysis, they make other
dialysis. Now we know when it comes to kidney failure, that is something that is big business. Horrible for people on dialysis, but for the companies that make the machines, who have the actual holding areas, the companies by itself, very, very big business.
Other things to help kidney patients, they're rising today on relief. Exactly.
And why is that, profiteers? Well, think about it. If we have a diabetes drug that's going to stop us from having dialysis, and it comes to find out it's not really helping us as much as we thought with us losing weight, then of course those companies will make dialysis or dialysis-related equipment, they're going to rise. But let's go to Invo. Let's look at the charts and see, is it a buy, a sell, or a hold? Let go. Well, my profiteers, look at this. You want to talk about run, baby, run. Run, baby, run. Did it run? Look at that. Look at that, man. Up. Well, how much you up, man? 103% since last year. You cannot beat that. Now, some might say, not the best time to buy. It's at an all-time high. I can see that. Couple things, though. Ozempic not going anywhere, and the weight loss craze will just continue. And it's killing this competition, right? Let's look at Weight Watchers. Ooh! Killing this competition. Now, Oprah came out and said basically she's not with Weight Watchers anymore. She actually came out after years of plugging Weight Watchers. She said, you know what? It ain't working for me. I'm taking Ozempic. So that was a boost. But look at Weight Watchers, though. Look at that. From October to now, yes, my friends, down by almost 80%. And I do not see Weight Watchers anytime soon going up, because you can do it two ways when it comes to losing weight. The old-fashioned way with diet and exercise. And we know they say diet and exercise, really just diet, because you can exercise all you want to. If you love those glazed donuts, you're in trouble. Or we can eat those glazed donuts, exercise when we want to, and take Ozempic made by NVO. So Weight Watchers down by 80%. I don't see that going up anytime soon, but NVO, I see that going up. My opinion, it's going to scale, and not only scale, as we kind of can see the breakout, right? The breakout was literally 55% since August 23. Well, my profiteers, if it's another 53%, might take about 2 years for that to happen. But let's go, let's go, let's go, let's go, let's go, let's go. 57%. We're looking at about $197 a share. Now, again, it might take 2 years, but making 57%, which is 28% a year, every year for 2 years, ain't nothing wrong with that. And as more people get comfortable, more doctors write prescriptions, and the insurance companies say, yeah, come on, pay that deductible, give you a higher deductible. We'll let you do it just because you're going to be on this more, and we get a kickback from the pharmaceutical company, NVO. This thing is going to run. So, yes, it is overbought right now, but I think long-term, a year, 2 years from now, might get up to $197 a share. If so, my profiteers, pretty good. Now, remember, I'm a certified financial planner for my clients on these YouTube streets. I'm just giving information, so take it with a grain of salt. Not telling you what to do, but definitely you want to do your research when you invest. Anyways, comment below. We at NVO. Is it a flash in the pan? Do you think that these medications will continue to have people lose weight? Do you think it's going to be a pause on the making of these drugs? Or do you think this is the future? Let me know what y'all think. As always, love is love. Let's make some paper profits together, y'all. Peace.
And you just want to get paid. Tired of making no money mistakes. Make a payment on your bills and you still late. Yeah, painful profits to help you seek change. And you just want to get paid. Yeah, tired of making no money mistakes. Make a payment on your bills and you still late. Painful profits to help you seek change. Yeah, cut the show and just listen. You want to feel empowered by making money decisions. Residual by the hours can get you a better living. Bitch at the check, you know, and it could be different. You know.